Panting. Panting is seen where? In case of lower animals. Okay. Vasoconstriction, piloerection, mechanism increasing heat production, shivering and non-shivering mechanism, increased activity and other behavioral responses. In behavioral responses, what does it cover? Just a short recap. We have behavioral changes. Whenever there is variation in the temperature, what all behavioral changes can be seen? Behavioral changes. What are behavioral changes? If it is some, what will be the behavioral changes? You will go for more of the liquids, you will go more for the ACs, okay, more ventilation, less clothing. So these are the behavioral changes, okay. Mechanism activated by heat is vasodilation and sweating. What is insensible perspiration? What is thermal sweating and what is cold sweat? You get an MCQ on this. So please be clear with this. What do you mean by cold sweat? And the areas involved in cold sweat is palm soles during the emotional stress. Thermal sweating is all over the body, okay. Now acclimatization, previous class I have told you about the acclimatization in case of hot environmental condition. The acclimatization takes place, okay, and there is slowly reduction in the secretion of sodium chloride. Cutaneous. Now abnormalities of regulation. In hypothalamus we have a set point, like in ACs, microwave, we set a particular temperature, that is a set point. So in hypothalamus we have a set point, okay. So this set point in case of human being is, mean is 36.8. It has a value from 35 to 37.5 degrees centigrade. So that is a set value. Whenever there will be difference or increase or decrease in this set value, okay, what will the hypothalamus do? Okay, the first common most example of the applied aspect comes is fever. Fever is different from hypothermia, okay, it is not the same thing. Hypothermia is for prolonged duration, the causes are different, okay, fever is different. What is fever? Is fever good? Yes. So what are the different causes of fever? The different causes of fever broadly can be categorized into maybe exogenous source or maybe endogenous source. When we are talking of exogenous source, the source is infectious, maybe bacteria, maybe virus, okay. The source is exogenous. In case of endogenous fever, the cause may be some kind of tumors, some other inflammatory problems, autoinflammatory diseases. So they may result into fever. The fever is when the set point of the body temperature, the set point is 36.8, that is the mean value, okay. But they have a range. That set point gets disturbed from the normal value to the higher value, okay. So this increase in the value of set point temperature results into fever. Now what happens? The hypothalamus is sensitizing that this particular temperature, suppose 39.8, due to fever a person is having 39.8 degrees centigrade temperature. So the hypothalamus will assume that this is the set point. In the last row, okay. Now this assumption of the hypothalamus that this particular temperature is the set point, which is new normal, for the body. So it is deficient of that particular 2 or 3 degree temperature from the new normal. So what the body will do? The hypothalamus will send signals for heat production or thermogenesis. What are the different mechanisms of thermogenesis or heat production? Shivering, vasoconstriction. If there is any kind of sweating, that sweating has to be reduced or that has to be stopped. Okay, so all the mechanisms which are responsible for thermogenesis or heat production will come into action, and all the mechanisms which are responsible for heat dissipation or loss will be inhibited or stopped. Now the body will reach to 39.8 degrees centigrade, assuming it to be a new normal. Okay. In healthy conditions, the set value in case of mean or average is 36.8. But in case of fever, what happens is this set point gets disturbed. It reaches to a new value or a higher new value, and that new value becomes the new normal. The temperature may increase to 40 degrees centigrade, may increase to 39 degrees centigrade. Now the hypothalamus is assuming that this value is new normal. Okay, when this new normal value has come into action, the function of hypothalamus will be to generate heat, that is thermogenesis. So all the actions, all systems which are involved in generating heat will get stimulated. All the systems which are responsible for heat loss mechanism will be inhibited or resisted. That will generate the heat, increase the body temperature to 39 degrees centigrade. But that is not healthy or good for the body. But fever is a symptom which shows that the body is having some sort of infection. Okay, it is an indication of some sort of infection occurring in the body. Now, how does this set point increases is the physiological mechanism or pathophysiology of fever. Does anybody have any idea? We are seeing that this particular normal temperature has been increased or set to a new value. But how this mechanism works is when we have a bacterial or a viral infection. The first line of defense is skin next to skin. What is the role of neutrophil and monocyte? Is there any role of neutrophil, monocyte, lymphocyte in defense mechanism? Yes. What is the most important function performed by monocyte? Monocytes. The first important function of monocyte is it is an antigen presenting. Okay. Antigen presenting cell. What is the function of neutrophil? It is responsible for phagocytosis. By this mechanism, it helps to defend the body. So whenever a foreign antigen, maybe bacteria, virus, whichever foreign antigen enters, they are captured by these phagocytic cells, maybe macrophages, maybe neutrophils. The cells, now what they will do, they will break down the external antigen. Okay, the membrane of that particular bacteria will be broken down. They will release certain chemicals. Okay, in blood through systemic circulation, it will reach to the hypothalamus. Okay, when it reaches to the hypothalamus, it is responsible for increase in the formation and secretion of prostaglandin E2. Okay, so the mechanism is whenever the antigen may be exogenous, may be endogenous, that exogenous, endogenous information we'll talk in afternoon session. That will be your clinical exposure. Okay, that will be taken by medicine department. So please be there in the class today and tomorrow. Right now what we are concerned is once the antigen enters into the body, what happens to the defense mechanisms, that is neutrophil, lymphocyte and monocyte, they break down, bring the chemicals, the liberated chemicals from these sources antigens, release into the formation of prostaglandin E. Now this prostaglandin E is responsible for change in the set value of hypothalamus. Okay. Fever is increase in the core body temperature above the normal value. Okay. Now what is the mechanism for this? Is increase in the secretion and formation of prostaglandin E2. And from where it is coming? Now this prostaglandin E2, it is responsible for shift in the set value of the hypothalamus. Okay. The fever itself is a protective mechanism. Okay. So it will try to resist, or it will try to fight the attacking organism antigen. Okay. So it will a better protective mechanism. But what we do is we take paracetamol, aspirin, ibuprofen. So these drugs, what they do is they will resist the increase in the formation of prostaglandin E2, which will again set the temperature back to the norm. So sometimes the fever may take 10 to 20 minutes to appear after infection, or it may occur very fast. Sometimes it takes time. But with the duration, the final result is we have to set the core body temperature back to the normal value. For increase or change in this, the body was generating heat. Now again the hypothalamus temperature has come back to normal. So the new normal has been abolished. Now it has to come back to the normal temperature. So which center will be stimulated? Heat dissipating mechanism. So what are the different heat dissipating mechanism is? Sweating. Okay. You will remove all your blankets. Okay. Fever में क्या होगा? आपको ठंड लगेगी. You will go for blankets and everything. गर्म ऐसे रूम में जाओगे आप जिसमें कि टेम्परेचर कम अच्छा वार्म होगा, तो उसका जस्ट रिवर्स कहाँ पे होगा? Once we have taken the medicine and within few times we will see the effect. The temperature has to come back to the normal value. Okay, and the mechanism, the drug aspirin which is acting is, it is abolishing or resisting the formation of prostaglandin E2. Okay, fever or pyrexia. Why we call it pyrexia? Because the causative agent, they are known as pyrogens. They are responsible for formation of heat, pyrogens. So this is pyrexia. Sometimes a person have pyrexia or fever of unknown cause. Okay, most commonly. So fever or pyrexia refers to increase in body temperature above the normal range. Causes can be infections, tissue destruction and unknown origin, most common. Okay. Fever occurs when hypothalamus set point is reset at a high temperature by pyrogens. Okay. Pathogenesis, endotoxins liberated by infecting agents and tissue destruction. Acts on monocyte macrophages, suffer cells. Release of cytokines. Act on hypothalamus, increase production of prostaglandin E2. Raises thermoset and activate heat production. You can write this in a flow chart. You can write this in a sequential manner to show the pathogenesis of fever. Okay, so you get a question on functions of hypothalamus and add a note on temperature regulatory mechanism of hypothalamus. Okay, or you may get a short note on fever or pyrexia. Okay, benefits of fever: inhibiting of growth of infecting agent, stimulation of antibody production and slowing down growth of some tumors. Harmful effects: results into dehydration, negative nitrogen balance, loss of sodium chloride, okay, alkalosis, damage to the brain and kidney if persistent, high temperature above 41 degrees centigrade. So, whenever a person is having fever, we monitor the temperature. Okay, we monitor the temperature of a patient regularly. The temperature should not rise above a particular 41 degrees centigrade, that will result into permanent damage. Okay, this is heat cramp, heat syncope, okay, and heat stroke. These are the कुछ और पढ़ना है या you are not interested, you can still leave the class. What do you mean by heat cramps? Is intense prolonged exercise in the heat. Heat cramps. So how it can be abolished or resisted? Prevention is cease exercise and rehydrate. Sign and symptoms is cramps, involuntary spasm of active muscles and low serum sodium levels. Okay, syncope, peripheral vasodilation and pooling of venous blood. If this is the condition, it will result into hypotension and hypohydration. In both the cases, in all the 3-4 cases, there is dehydration, so the body has to be rehydrated regularly. What do you mean by hypothermia? Results when the ambient temperature is low, that the body is heat. What is the beneficial effect of hypothermia? नहीं, ठीक है, अपन इसको क्लिनिकली कहाँ अप्लाई कर सकते हैं? करते हैं किस टाइप की सर्जरी में दिस इज बेनिफिशियल? यस, ये तो बहुत अपन जनरली सुनते हैं ना कि ग्रीन कॉरिडोर इज क्रिएटेड लेस ऑफ द टाइम द हार्ट इफ द ऑपरेटिंग system is on live pulsatil heart or anything of that sort, if radiotherapy surgery, then this hypothermia is beneficial. Other than this, it will create an havoc. Okay, decreased metabolic activity leads to reduction rate of both oxygen and carbon dioxide, hypocapnia, acid weight disturbances, electrolyte, blood abnormalities, slowing of respiration, lowering of blood pressure, slowing of risk gases, unconsciousness and even death if temperature is lower than 25 degrees. What is the lower lethal temperature of the body? Lower lethal temperature of the body 23. And what is the upper lethal temperature of the body? 43. मैं इसलिए रिकॉल करा रही हूँ कि अभी जो अपना MCQ वाला सेशन होगा, इसलिए आई एम रिकॉलिंग. ओके, now please take out your page, single page, just write down your name, your roll number, that will be your attendance. You just have to mark A, B, C or D and please write it in capital letters. Question number 1, A, B, C, D, and the answers I'll tell you during afternoon class. Okay, you just have to write down the answers. That has to be written in capital letters. If it is not written in capital letters, it will not be marked and you will get an absent. Clear? The instructions are clear? Write down your name, your roll number, please. And it should be written clearly, no confusion. A major source of heat production in infant is, no whispering, nothing, just write down your answers. Please. It is just an immediate feedback or the analysis. Okay. Next. At normal room temperature, most body heat loss is by which mechanism? At normal room temperature, most body heat loss is by which mechanism? I'm not asking, this is not a viva, okay? Third question is, constituent of secreted sweat are similar to plasma except for proteins, chloride, bicarbonate or potassium. Is there any need for discussion? Okay. The only available mechanism of heat transfer when the environmental temperature is greater than the body temperature. It was previously the room temperature. Now the thing is, the only available mechanism of heat transfer when the environmental temperature is greater than the body temperature. किंशुक यहाँ पे भी है. Shall we move to next? Okay. Cause of thermogenesis in the body is skeletal muscle relaxation, assimilation of food, decreased cardiac metabolism or hypothyroidism. जितना आपको खुद को आता है ना उतना ही पास वाले को आता है, इसलिए एक दूसरे में मत देखना और नेगेटिव में जाओगे. Major factor resulting in increase in body temperature during exercise is heat dissipating mechanism inefficient, enormous thermogenesis, vasoconstriction or non-working muscles or resetting of thermostat. Done. Site which reflects the true value of core temperature. There is difference in the temperature taken at the peripheral areas and at the core areas. Okay. So site which reflects the true value of core temperature, esophagus and rectum, tympanic membrane, vagina, all of the above. BMR is dependent on body weight, surface area, amount of lean body mass or height. Next, one feels hotter on a humid day because rate of sweating increases, surrounding temperature is more, heat loss by the body via process of radiation decreases or rate of evaporation of water from body decreases. A major factor resulting in increase in body temperature during exercise is heat syndrome is adverse reaction to the heat exposure, heat cramps, heat exhaustion and heat stroke. Summary of effector mechanism in temperature regulation. Okay. Next question. They were not questions, they were just a recap slide. Okay. They were just recap slides. Okay. Thermal sweating differs from non-thermal sweating. This question 7. Okay. क्या 10 हो गए थे ना पहले, तो 9 कर लो, उसको 10 कर लो, ठीक है, कोई वो दिक्कत नहीं है. चाहो इसको 1 कर लो. क्वेश्चन मुझे पता है, आंसर सीक्वेंस पे चल रहे हैं अपने, ठीक है. Write down question number 1. Don't get confused. Okay, previously there were question 9. Right now we have started a new thing. Okay, this is question number 1. Write down answer of this question. Question number 1. Okay, and the question is thermal sweating differs from non-thermal sweating. Done? Core temperature of 26 degrees centigrade leads to death due to brain damage, respiratory insufficiency, cardiac failure, or all of the above. Which area of hypothalamus functions as thermostat? Preoptic. Okay. Insensible water loss or perspiration will be absent if humidity is 100%. Clear? Hydrogen raises body temperature by releasing interleukins. These interleukins and prostaglandin will change the thermostat. So they have a steps to follow. Okay, you have to select the best out of the 4. In some MCQs you get more than 2 to be correct, but you have to select one of. Heat loss process of the body not directly under physiological control is. Not under the physiological control is. Not under physiological control. Done? Fever is caused by interleukin 1. उससे मत डिस्कस करो, कोई अभी बता देंगे, तो चिंता तुम लिखते रहो बस. During exposure to cold, body temperature is raised by vasoconstriction in the skin, horripilation, thermogenesis, all of the above. Profound hypothermic signs include all except show breathing, bradycardia, hypotension, hyperactivity. Hypothermic signs include all except aspirin decreases the body temperature by inhibiting the prostaglandin synthesis. When the core body temperature falls below the hypothalamic set point temperature, what will happen? All of the above? Thank you. Now submit your paper. You are responsible for this row. Collect the papers. Fast, collect papers. Collect all. Okay. Lakshay, collect all the papers. Collect all the papers. Stand up and collect all the papers from this side. This is your attendance, so please be specific in writing your name and roll numbers.